Hello and welcome to Pregnancy Info. Today we are going to discuss about unexplained infertility. What is unexplained infertility? Its causes, its treatment, and each and everything we will explain in detail. But what is unexplained infertility? Unexplained infertility is a term healthcare providers use to describe infertility after tests reveals no obvious cause for your fertility problems. Provider only diagnose unexplained infertility after both partners have had complete fertility evaluations. Often these tests reveal no uterine abnormalities or structural issues with your uterus. Ovulation occurs at regular intervals. Your fallopian tubes are open with no obstructions. Your egg count is good. Your brain produces normal level of hormone needed for reproduction. Your partner's semen analysis is normal. People diagnosed with unexplained infertility have been trying to get pregnant for at least 1 year if you are younger than 35 years or 6 months if you are older than 35 years. How many couples have unexplained infertility? The exact rates vary because the definition of fertility testing varies. What one provider considers standard or comprehensive fertility testing may differ from other providers. According to one source, in 10% of couples trying to conceive, fertility tests are normal and there is no detectable cause for infertility. But another source says unexplained infertility cases are as high as 30%. Now question is it possible to get pregnant with unexplained infertility? Yes, it's possible to get pregnant if you are diagnosed with unexplained infertility. A study with the National Institute of Health (NIH) found that 92% of couples with unexplained infertility who had fertility treatment ultimately had a child. Now we will discuss the causes or symptoms. Unexplained infertility has no cause, or if a cause exists, provider cannot measure it or test for it. Some possible reasons for unexplained infertility are: number 1, an undiagnosed underlying condition. No one is completely sure how every condition affects fertility. Researchers are always studying to learn more about how our bodies work. For example, celiac disease, diabetes, and thyroid conditions contribute to infertility. Number 2, endometriosis. Even mild cases of endometriosis could contribute to infertility. Your healthcare providers diagnose endometriosis in surgery. Even mild endometriosis or endometriosis with no symptoms could contribute to infertility. Cervical mucus. Your cervical mucus helps sperm swim up to meet your egg during ovulation. If your cervical mucus is thick or contains certain ingredients, sperms may not be able to travel through your cervix and vagina to get to your uterus. Egg quality. Healthcare providers can measure low egg you have through an ultrasound, but ultrasound doesn't tell them about egg quality. Blood tests and ultrasound can give clues about the quality of your eggs, but it is not a definitive diagnosis. Sperm quality. Similar to eggs quality, a sperm analysis reveals most problems with sperms, but there may be other issues with sperm that contribute to unexplained infertility. Uterine lining. Your endometrium is the lining of your uterus. It's what an embryo sticks to and grows in during pregnancy. A luteal phase defect is when your endometrium doesn't thicken or prepare itself for a fertilized egg. Poorly timed intercourse. The frequency of timing of sex isn't matching up with ovulation. Sometimes there is no cause or the cause is hard to diagnose or treat. Now we will discuss diagnosis and tests. There is not one fertility test that can diagnose all irregularities that cause infertility, and testing methods aren't 100% accurate. The American Society of Reproductive Medicine says fertility testing should include a complete medical and sexual history, a physical exam, blood tests to look at hormone level, assessment of reproductive organs such as your ovaries, fallopian tubes, and uterus. They may include ultrasound or more advanced imaging tests like a salpingogram or laparoscopy, semen analysis, ovarian reserve testing, checking your ovulation. What is the treatment? Because your healthcare provider cannot identify one cause of infertility, they will most likely recommend treatment based on your fertility test results and their experience with similar couples or individuals. Other factors include how aggressive you want to be with treatment and your age. The most common treatment fall under the following categories. Number 1, assisted reproductive technology or ART. ART is a type of fertility treatment that usually involves part of the fertilization process happening in a lab. ART treatment includes intrauterine insemination and in vitro fertilization. IUI is when providers wash and concentrate sperm in a lab before injecting it into your uterus at ovulation. IVF involves creating embryos in a lab using your eggs and your partner's sperms and moving the embryos to your uterus to grow. Medications. Medications that stimulate egg production and ovulation are helpful, and you can also use them alone or with IUV and IVF treatment. The most common medicines are gonadotropins and clomiphene. Some providers prescribe letrozole for fertility, but it's an off-label use. Lifestyle changes. Several lifestyle factors contribute to infertility. Some things you can do to help your chances of conceiving are avoid smoking, drinking alcohol, and using recreational drugs. Maintain a healthy weight. Eat a balanced diet. Try to get 30 minutes of exercise each day. Limit caffeine consumption. Reduce your stress. Improve timing of intercourse. There is a small window of time in your menstrual cycle that conception can occur. Your healthcare provider may help you identify this window to maximize your chances of getting pregnant. This could involve taking your temperature, charting the cycle, or using ovulation kits to predict ovulation. You can watch our videos about ovulation too. Now, there are some preventions that you can take. While you can do things to increase your chances of conception, some infertility factors are out of your control, but some of the factors within your control are: number 1, weight. Maintain a weight that's healthy for you. Smoking, tobacco, drinking alcohol too much is not good for you, so stop it. Sexual history. Reduce your risk of STIs by wearing condoms. Take your healthcare providers about your fertility concerns so they can recommend the next steps for your care. In the end, one more question is that how many couples with unexplained infertility get pregnant? One study found that up to 43% of people eventually got pregnant without fertility treatment. So hope for the best and try to conceive as early as you can. Must share this video with friends and family members and the girls who are trying to get pregnant soon so that video can help them too. Also subscribe